Thank you, Glenn. There are studies that talk about the immunity that people who have survived COVID naturally develop. They survived it. New at 4, Channel 2's George Estevez talked to the doctor at Piedmont Hospital about immunity from infection versus vaccine.
All right, Dr. Morgan, just this week, we've looked at Israel in the past to see what they've been uncovering with COVID. They're saying having COVID gives you more protection than getting the vaccine?
Yeah, natural immunity is only better if you survive the disease. So let's not forget that. And so they're looking at people who've actually survived the infection. And they did include people who died from the infection, as opposed to the vaccinated group included all of those who were immunocompromised or weakened or at risk, but were vaccinated and protected. And so it's very difficult when you look at this study to compare apples to apples. Don't forget, natural immunity suggests that you have survived, and the survivors go on to have good immunity. But that is a risk because people do die in the process.
Right, because just a few weeks prior, the CDC saying, no, vaccinations, that's what needs to happen. That's your protection. So we should listen to who?
So I know that it's confusing, and we'd like to see more and more of this data come out. One point that I thought was an excellent point in the Israeli paper is that people who have survived COVID and move on to receive at least one dose of a vaccine have exceptionally great immunity. And that really makes sense because the disease itself served as the first shot. And then the second shot really is that second dose that the rest of us receive. And so I think that makes sense. I think we need to see papers like this that have not been peer reviewed. We need for them to be reproducible. So we need to see this research done in other places. We need to see control groups. And most importantly, we have to keep in mind that people who have long-term immunity from COVID have survived the disease. Many did not survive. So it is a risk to put yourself in a position to have natural immunity.
And that's the key here. Those who survived, the goal here is to make it through this without hospitalization and without death. Dr. Jayne Morgan, Executive Director of the COVID Task Force at Piedmont. Thank you.